This is Oliver. He's a 7-year-old male and he has a history of cough and fever. For a 7-year-old, he is well, he has no past medical history and takes no medications. Oliver comes into hospital. You take a history, you do an examination, and you do some observations. His respiratory rate is 24. His SATs, they're 92% on air. His heart rate is 100. His blood pressure is 120/75. And his temperature is 39.5. You do a chest x-ray, and that shows that he has some left lower zone consolidation. You do some blood tests, and he has a raised white cell count, and he has a raised CRP. Based off this information, you diagnose him with a pneumonia, and you begin him on some IV antibiotics. Almost immediately, you notice that Oliver has become unwell. His face and lips are swollen. He's become red and he's become flushed. His lips have gone blue/purple. He's become short of breath and he has an audible wheeze and an inspiratory stridor. As your concern grows, you begin to wonder to yourself, what has happened to poor Oliver? Hi, welcome back to Educational Notes. Today we're talking about anaphylaxis, which is a type 1 hypersensitivity reaction. Anaphylaxis is a life-threatening medical emergency. It's characterized by sudden onset, rapidly progressive problems in a patient's airway, their breathing, and the circulation. So, anaphylaxis is called a hypersensitivity reaction. Now that's an abnormal immune response to a foreign substance. In this case, the foreign substance is coined an allergen. Now, allergens can cause mild to severe reactions. An example of a mild allergen is pollen. Now, pollen causes a local allergic response, which gives you the signs and symptoms consistent with hay fever. Anaphylaxis lies on the severe end of this spectrum. So the common triggers of anaphylaxis include peanuts, drugs, and venoms or stings. However, this isn't an exhaustive list. Hypersensitivity is an IgE-mediated reaction. IgE is an immunoglobulin isotype which is involved in the immune response to parasite infections and the immune response to allergens. Immunoglobulins are made from 2 heavy chains and 2 light chains. They contain an antigen binding site and also a fragment crystallizable region or FC site. This is important for mast cell binding. Broadly speaking, there are 2 stages in type 1 hypersensitivity reactions. The first stage is called sensitization, and this is where the body is initially exposed to the allergen. The second stage is called re-exposure, where the body is subsequently exposed to the same allergen again. So let's have a look at the process of sensitization in a little bit more detail. Here we have an antigen-presenting cell. Antigen-presenting cells, or APCs, take in allergens or foreign substances and subsequently present them on their cell membrane. These antigen-presenting cells then migrate via the lymphatic system to the lymph nodes. It is here where they come across the naive T helper cells. There is an interaction between the APC and the naive T helper cell. This is via the T helper cell binding to the antigen on the surface of the antigen-presenting cell. This is achieved via multiple receptors on the naive T helper cell. This then causes the naive T helper cell to be primed into a type 2 T helper cell. This type 2 T helper cell subsequently secretes cytokines. These include interleukin 4, interleukin 6, and interleukin 5. Both interleukin 4 and interleukin 6, but mainly interleukin 4, orchestrate B cell class switching to favour IgE secretion. These IgE antibodies are specific to the antigen which led to their creation. In this case, the antigen is an allergen. Interleukin 5 is involved in the activation of eosinophils, and eosinophils themselves secrete their own interleukins and also leukotrienes, which are involved in the biphasic reaction of anaphylaxis. Another important cell is the mast cell. These can be found in connective tissues throughout the body, including blood vessels and the dermal layer of the skin. The cell membranes of mast cells contain a receptor for the fragment crystallizable region. These bind to the fragment crystallizable region of IgE. The surface-bound IgE can now bind to the allergen on subsequent re-exposure. Following this, the mast cell is now sensitized. Thanks for watching part 1. Join me again for part 2. If you want to learn more, please watch these 2 videos and don't forget to subscribe. See you in part 2.